Welcome to today's NCLEX question of the day. In this case, we are discussing a neurological emergency involving cranial nerve dysfunction. Understanding how to prioritize care in these scenarios is essential for both the NCLEX and real-world nursing practice. Let's begin with the case. A 68-year-old female is admitted to the emergency department with difficulty swallowing, hoarseness, and an unsteady gait. During the assessment, the nurse observes asymmetry in soft palate movement, loss of the gag reflex, and the inability to shrug her shoulders against resistance. Her vital signs are concerning. Blood pressure is 88/50, indicating hypotension. Heart rate is 110 beats per minute, suggesting compensatory tachycardia. Oxygen saturation is 95% on room air, which is adequate for now. The nurse recognizes that cranial nerve dysfunction is likely impairing swallowing and airway protection, putting the patient at high risk for aspiration and respiratory complications. Which intervention should the nurse implement first? A. Elevate the head of the bed to 45 degrees and apply supplemental oxygen. B. Administer IV fluids to improve blood pressure and support circulation. C. Place the patient in a side-lying position to reduce the risk of aspiration. D. Perform a neurological assessment to monitor for signs of increased intracranial pressure. Take a moment to think about your answer. The correct answer is C. Place the patient in a side-lying position to reduce the risk of aspiration. This patient has signs of cranial nerve dysfunction, specifically affecting swallowing and the gag reflex. When the gag reflex is impaired, the risk of aspiration is extremely high. Aspiration can quickly lead to airway obstruction, respiratory distress, and pneumonia, making it the most immediate threat to patient safety. Placing the patient in a side-lying position allows secretions to drain safely from the mouth, reducing the risk of aspiration-related complications. This is the most effective preventative measure to protect the airway in a patient with impaired swallowing. Let us review the other choices. Option A. Elevate the head of the bed and apply oxygen. Raising the head of the bed can help, but it is not as effective as placing the patient in a side-lying position when they have a completely absent gag reflex. Oxygen is not needed at this time, as the patient's oxygen saturation is already at 95%. Option B. Administer IV fluids for hypotension. While fluids are important for circulation and blood pressure, aspiration is the more immediate concern in this case. Airway protection always comes first before circulation in a patient who is at risk for aspiration. Option D. Perform a neurological assessment for increased intracranial pressure. While a full neurological assessment is important, interventions should never be delayed when a patient is at immediate risk for aspiration. Safety interventions take priority over assessments in cases like this. Key takeaways. Aspiration risk takes priority in patients with cranial nerve dysfunction and impaired swallowing. Positioning the patient in a side-lying position is the best way to prevent aspiration. The ABC framework must be adapted. Sometimes airway protection is more important than circulation support. Assessments are important, but when immediate safety is at risk, take action first. Did you get the answer right? Let us know in the comments. Join any of our NCLEX sessions and courses for structured test-taking strategies and priority intervention breakdowns. Reserve your spot today at nclexsage.com. Thanks for watching, and I will see you in the next video.